So my name is Effie Marathia. I'm currently a final year PhD student at the University of Dundee. I study in psychology, and prior to that, my background is all in psychology and health psychology in particular. So I did my master's in Aberdeen, at the University of Aberdeen, looking at health psychology, but also at the same time I was working for a charity, working with people with disabilities, trying to get into work. So I'm just really interested about how our health behaviours are impacted by psychological processes, and that's why I became interested in this area of smoking and trying to understand the kind of psychological factors that affect smoking and smoking cessation. This particular piece of research is about understanding how people quit smoking without formal help. Another term for it is self-quitting or unassisted quitting, and we became really interested in this area because there's not a lot of work that has been done in this field before. There's been a lot of work around the use of aids like nicotine replacement therapies and varenicline, other sort of medication, but self-quitting has gone rather unsearched, if you will. It hasn't been so well documented. So I became interested in this project, I would say, due to my background with health and psychology. So the starting point for this work is really understanding how do people quit without that additional help. And in psychology, we see that it's all about willpower and this idea that we can exercise brute force to prevent ourselves from engaging with a temptation that's incongruent to a goal like quitting smoking. However, the problem with willpower, as you can imagine, is that it's often defined in a kind of rather circular moment. So people assume that you have willpower because you are successful at quitting or changing your behavior, but at the same time, you are successful because you managed to change. So this really isn't helpful in trying to, help other people to quit. So this was really our starting point to try and think about and unpack how can we help people change. And what we do is, as psychologists, we look at a lot of theories that explain behavior, and the sort of two areas that we are interested in is how do people self-regulate. What sort of situations are important when it comes to changing behavior and intervening? And we've seen that, I already mentioned the key word here is the situation itself. So can I avoid certain situations, or can I put myself in situations that are helping me to achieve my goal of quitting? But the other component of change is my inner thoughts and feelings, because we know cravings for smoking can be quite overwhelming. It's all about trying to distract ourselves, trying to change the way that we think about smoking so that it becomes less appealing. So really it's about trying to unpack, taking it back to that idea of willpower and coming up with more tangible, concrete things that people can do in order to change their behaviors. I did learn lots of things from, my own journey with this research. I actually learned that people who self-quit don't just use brute force. This is actually something that happens the least amount of time. And people are very sophisticated in the way that they change. They intervene on their environment in a number of ways. They avoid situations, they change their habits that they associate with smoking. They also change their social environment, which came through quite strongly, actually. So they will change the people that they associate with. They will meet new people, they will seek new experiences. So they're very sophisticated in the way that they change their behavior. And actually this connects really well with the efforts of our public health and our public policy, which really targets the physical environment. Think about the creation of smoke-free spaces, for instance. This is exactly what people are also trying to achieve. They're trying to change their social and physical environment. So it's good to see that the current policies that we have are actually assisting people to do that, and hopefully there's more potential for further policies in this area. The question of impact for this research, so how can we apply these research and this learning from self-quitting. As I mentioned, policy is one thing, so thinking about the legislation that covers smoke-free spaces. But also something that we as psychologists also think about a lot of the time is service provision, and how can we tailor the smoking cessation service to more people and to a way that, in a way that's helpful for people to actually make lasting change. So I think in terms of service provision, could we have an approach where we personalize and we tailor the smoking cessation service that we provide to people in a way that people can choose what strategies work for them, and they need to be learnable and actionable strategies that people can use. It's not about advising people to suppress cravings, and I'm not saying that that's what happens, but it's about giving them the tools that they can use in their own personal and unique circumstances, really. So one thing is about recognizing that and really encouraging people who are feeling ready to quit without assistance. It doesn't assistance is not something that we try to deter people from, but we'll see that a lot of the time, people have tried different methods. They've tried going unassisted, they've tried assistance, and then they've circled back to not using assistance. And it's about recognizing that that can be a viable option for them too. And I think the third application is also about the messaging and the sort of campaigning that we do around this area. And a lot of the previous media campaigns, we've seen some evidence suggest that it mainly appeals to some groups in society who usually are more affluent, who are usually more kind of future oriented. So talking a lot about risk of disease that tends to resonate more with more affluent people in society. But it's also important to think about that we need to help out people who want to quit but who are in less advantaged and they're more affected by deprivation. So how can we do that? We know that people tend to be more focused in the short term, so can we tailor some communications to the short-term benefits? So things like saving money, things like relieving short-term symptoms like coughing, that sort of thing. So I started off with self-quitting, but you can see I'm going to another area as well, and it's also about motivating people for the reasons that are right for them.